Hello friends. So in this video we are going to see about the dental growth and assessment in children. So if you talk about the dentition before birth, you can say it is full and full depends on the mother's nutrition because when the baby is in uterus or in the womb, these teeth begin to develop and around the 5th or 6th week of pregnancy. So it is understood that the sole responsibility is on the mother. If we want to see the good dental growth in children, and the process is already started when the fetus is in uterus. So it is the responsibility of the mother to feed the baby in a well balanced manner in order to have this well developed dentition or to have normal dental growth. So during this time, the nutrients that the baby needs come from the food that the mother eats. And it is important that the mother has a well balanced diet with an adequate intake of calcium and phosphorus and other minerals and vitamins, which helps the baby or the fetus to have normal dentition once the baby comes out of the uterus. So by week 8, the tooth buds of the primary teeth can be seen in an ultrasound. So it is visible through the procedures. We can identify it is in a developing stage. Tooth buds are. So that is primary teeth or the milk teeth we are talking about. And if you see the normal anatomy of the teeth, we have some types of teeth, that is incisors, canines, molars and premolars. So altogether it complete the process and it occupies the upper and the lower jaw. So the overall it gives the figure 32 as a permanent teeth, and we have 20 temporary teeth or deciduous teeth in children. So if you want to evaluate the dental growth, first of all we must understand the different types of teeth the children develops. One is in the beginning stages, before the permanent teeth erupts, the child will have a kind of teeth called milk teeth or deciduous teeth, and it starts erupting at 6 months of age, and the permanent teeth, that is at about 6 years of age, we can expect in the children. And there will be 20 primary teeth or milk teeth or deciduous teeth, or you can say it is otherwise called baby teeth in children, that is totally 20 in numbers. And all the deciduous teeth are replaced by the permanent teeth by the age of 12 years. So at around 12 years of age, all primary teeth are replaced by the permanent teeth. And a child between the age of 6 and 12 years has a mixed dentition. Primary is also available, and the baby has already started growing of this permanent teeth. So it is a mixture of dentition is uh, evident in children aged between 6 and 12 years. And if you see the eruption of this primary or deciduous teeth time period, first we'll start with the maxillary point, and by birth the child has no teeth at all, and central incisors will erupt at around 7.5 months, and shedding time period is around 7 to 8 years of age. And lateral incisors will erupt in children at 9 months of age, and the shedding time period is around 8 to 9 years. And the canine teeth you can see in children at around 18 months, that is 1 year and 6 months, 1.5 years eruption time is, and the shedding will be around 11 to 12 years of age. And first molar, it is around 14 months of age, that is 1 year and 2 months of age, and the shedding will be around 10 to 11 years of age. And the second molar is when the child is 2 years old. It is the eruption time of second molar, and shedding time is around 10 to 12 years. So this is the maxillary part, the teeth eruption and the shedding time period. And if you see the mandibular region, central incisors, that is around 6.5 months, and the shedding time will be around 6 to 7 years of age. and the lateral incisors will erupt around 7 months of age, and the shedding time period is around 7 to 8 years. So similarly, canine, it is start to erupt around 16 months, that is 1 year 4 months of age, and shedding time period will be 9 to 11 years. And first molar, when the child completes 1 year of age, that is exactly 12 months, and the shedding time period will be 10 to 12 years of age. And second molar eruption is around 20 months, that is 1 year and 8 months, and around 11 to 13 years this will be shedding. This is the mandibular region eruption of deciduous teeth. Now how this figure, how it makes out 20 numbers. Let us see, there are 20 primary teeth in children. So in each jaw you can see 2 plus 2, as a set you can see 4 second molars, 4 first molars, and 4 canines, 4 lateral incisors teeth, and 4 central incisors teeth. So collectively it makes a figure of 20 teeth. So in each, for second molars 2 you can see in the upper jaw and 2 on the lower jaw. Similarly all other type of teeth also in upper and lower part 2 each you can see, and collectively you get the figure of 20. Right? So primary deciduous teeth or milk teeth or baby teeth or the temporary teeth available in children, it is only 20 in numbers. And if you talk about the permanent teeth, the child will have 32 numbers of permanent teeth, and in each jaw there are 4 incisors, 2 canines, 4 premolars, and 6 molars, and totally it makes the figure 32. Right, this is about the permanent teeth. Starts to erupt in the children when the child is around 6 years old. And if you see the exact time period of the eruption of this permanent teeth, both in maxillary and mandibular region, that is upper and lower part. Central incisors around 7 to 8 years in the maxillary, and in mandibular around 6 to 7 years of age. Lateral incisors 8 to 9 years, and in mandibular it is 7 to 8 years. Canine teeth erupts in maxillary region around when the child is 11 to 12 years of old, and mandibular region when the child is 9 to 10 years. So it starts erupt first. And first molar it is 10 to 11 years in the maxillary region, and mandibular region it is between 10 to 12 years of age. And the second premolar, it is similar to the first molar, 10 to 11 years of age, and even mandibular also the same time duration it erupts. First molar, it is around 6 to 7 years it starts erupting in maxillary, and simultaneously it erupts in the mandibular region as well. And second molar start to erupt when the child is around 12 to 13 years of age, and mandibular also it is 11 to 13 years. So third molar there is no difference, both maxillary and mandibular region at the same time it starts erupting, that is around 13 to 17 years of age. So this is about the eruption time period of permanent teeth both in maxillary and mandibular region. So this is about the dentition in children regarding temporary dentition and the permanent dentition. Thank you.